Rule number 6, memorize lab values. Lab values is a question that we get a lot on NCLEX Expert because, as you all well know, depending on which core nursing textbook you read, you're going to find slightly different ranges. So the question that we get a lot is, what does NCLEX think is normal ranges? Well, they understand, just like you do, that there are different ranges in core nursing texts. So when they write a test question and use lab values, the lab values are going to be well within or well outside what are all of the published ranges. So don't get crazy about memorizing a specific range. Do you need to memorize a range? Yes, you do. Will they ask you a question, what is a normal potassium? 3.5 to 5. They won't ask that kind of question. What they will do is they will set up in a situation where they will give you a list of lab values and they will ask you which action should the nurse take first. So you certainly need to use your knowledge about what are the normal ranges in order to interpret your lab values, but then you're going to have to go that next step and decide what to do about it. So again, don't get crazy about the ranges. Memorize a range, whatever range you're comfortable with, and answer your questions based on that. But no, they're not going to ask you about the normal range. You're going to have to interpret the information to make a nursing judgment about your client. Rule number 7. Communicate therapeutically with whomever you are communicating throughout the exam. Now, when it comes to therapeutic communication, this is really kind of interesting. I find that nurses are either really comfortable with it or they have challenges with it. So if you're comfortable with it, you're going to be fine on the exam. If you're not comfortable with it, I'm going to give you some different ways to look at the answer choices. If there's anybody listening to this who English is an additional language, therapeutic communication can sometimes be a challenge for you. Again, pay attention to the ways that we're going to talk about how you look at the questions to help you select correct answers. Now, if you've listened to the test-taking workshop, you know we always say eliminate answer choices. So that's what we're going to do first. We're going to eliminate. We're going to eliminate all answer choices that are authoritarian. If the answer choice, no matter what the words say, kind of translates into do it because I say so, we're going to eliminate it. So we eliminate all answer choices that are authoritarian. We eliminate all yes-no questions. So if an answer choice says, does your leg hurt? And the client can answer it yes or no, that's not a therapeutic response. And the reason for that, it closes off all communication. If the patient says no, then what do? Or even if they say yes, you have to keep going. So you want to eliminate answer choices that can be answered yes or no. Now, I do have a caveat here, and that is the rhetorical question. The rhetorical question is a question that's more of a statement, but it's in a question form. So, for an example, if I say to you, do you want to go to my office and talk about this after you've had a problem, passing medication? You know that I'm not giving you a choice. You don't get to say, oh yes, I'd like to go, or no thank you, I think I'll pass. It's a question, but it's in a statement form. So when you have an answer choice on a therapeutic communication question that can be answered yes or no, your next thinking should be, is this rhetorical? Are they really making a statement in a question form? If you decide that no, this is truly seeking information from the client using a yes/no question, then you would eliminate it. If you decide it's rhetorical, you might leave it in for consideration. Another type of answer choice that we eliminate are why questions. And sometimes why questions can sound therapeutic, they can sound real touchy-feely. Why are you feeling this way? Why are you feeling sad? Well, the problem with a why question is the person has to defend why they're feeling the way they're feeling. So it elicits a defensive response from your client or whomever you're talking to. So it's very important on the NCLEX examinations that you eliminate those responses that are going to make the client or the staff member, whomever you're talking to, defensive. You do not explore on the NCLEX examination. We are not junior psychiatrists. We're nurses. The other thing to think about on the NCLEX examination is it's a real here and now test. They want to know what decision you're going to make right now. If you get into the motivation about, the reasons why somebody's feeling the way they are, in doing that, you're putting off a decision. Now, if you're a psych nurse, it may be the right thing to do. It's part of your position. But on this examination, it's here and now. Remember back to Rule 1. They want to know what judgment you're going to make. So therefore, exploring is not a right answer, and you're going to eliminate it. Do not say, don't worry, in any form. So if the answer choice translates into, everything's going to be okay, you want to eliminate it. And the reason that you want to eliminate it is if a patient tells you that they're frightened about something and you say, it's not going to happen, everything's going to be fine, you're negating that client's feelings. They're still feeling the way they're feeling. So you're going to eliminate all answer choices that say, don't worry. You're also going to eliminate answer choices where the focus is on the nurse and not the client. So, again, those can sound therapeutic. Hey, I know what you mean. That happened to me with my son. Well, it sounds like you're empathizing with the client, but if I say to somebody, I know what you mean, that happened to me too, where is the focus of my response? It's on me, the nurse, and not on the client. So you do not want to focus on the nurse. You want to focus on the client. So you will eliminate these types of answers. So we've talked about what you're going to eliminate. What type of answers do they think is correct? First of all, you are going to select answer choices that are empathetic and they reflect the client's feelings. You're picking up from what the client's saying is that they're feeling frightened, and that's what you reflect. You feel frightened. And sometimes I think on test questions, they're kind of hard answers to pick sometimes because they just don't sound right. The patient says, I'm scared, and you say as a nurse, oh, you're frightened. But yet that is reflective. So you want to be empathetic and reflect the client's feelings. You want to select answer choices that give correct information. Now, in a perfect world, you would have an answer choice that is reflective and gives information, but sometimes it's just one or the other. That's why I don't want you to look for the correct response. I want you to read a response and decide, do you eliminate it or not? Whatever is left becomes your correct response. Now, I've got a test question here that we're going to look at. The client is admitted with a diagnosis of acute myocardial infarction. The client tells the nurse, I am scared. I think I'm going to die. Which response by the nurse is most appropriate? I have to tell you, when I read questions like this with this type of a stem, I always want to read the answer choices and make sure I know exactly what this question is asking. So first, we're going to look and make sure that this is indeed a therapeutic communication question. And we determine that by our answer choices. Number 1, you will be fine. We will take good care of you. So that answer choice is addressing what the client said. I'm scared. I think I'm going to die. I know this is scary. I thought I was having a heart attack once. Again, that's addressing the client's feelings. I will ask your healthcare provider to tell you how you're doing. So it is addressing the feelings. Number 4, it's normal to feel frightened. We are doing everything we can for you. Now, based on those answer choices, what is the question asking? It is asking about therapeutic communication. Going back to the STEM, most appropriate says what to you? It says your discrimination is required in answering this question. Now let's erase our answers and we're going to go back and go through the answer choices one at a time. Number 1, you will be fine. We will take good care of you. Now what does that translate into? You're going to be fine. Don't worry about it. And remember, that's don't worry answer choices are one of the answer choices we eliminate. So we're going to eliminate number 1. Number 2, I know this is scary. I thought I was having a heart attack once. Now, I don't mind the first sentence. I know this is frightening. You're reflecting back feelings. But then it goes off the rails on the second sentence. I thought I was having a heart attack once. Where is the focus of that response? It's on the nurse, so we're going to eliminate it. Number 3, I will ask your healthcare provider to tell you how you're doing. Now, what's wrong with that answer choice? Well, first of all, it doesn't respond to what the patient's feeling. Remember, we're supposed to respond to their feelings, and that one doesn't. This is also an example of passing the buck. The patient has said something to the nurse. It is the nurse's responsibility to respond back to the patient. So, I don't like that answer. I really hope I like number 4. It's normal to feel frightened. Okay, we're giving information there. We're also reflecting what the patient is feeling, and we're doing everything we can for you, giving information again. So therefore, our correct response is number 4. Now, one thing I want to say on this one, for those of you all that feel pretty comfortable with therapeutic communication and you do pretty well with those questions, you may not want to go through this to try and eliminate answers. But if you have English as a second language or you're a nurse that simply is challenged by therapeutic communication, I recommend that you go through and think through your answers in this way.